Welcome to the Advanced Pain Care podcast series, where we explore innovative approaches to pain management and patient-centered care. In this episode, we sit down with Matt Sage, Director of Pharmacy at Advanced RX, a longtime partner of Advanced Pain Care. With over 20 years in pharmacy, Matt shares how his journey from big chain management to a more community-driven model has reshaped patient engagement, improved medication access, and driven real health outcomes. From custom compounding and CBD counseling to tech-driven convenience and workman's comp solutions, Matt gives us a behind-the-scenes look at the pharmacy's mission to make care more personal, accessible, and effective. All right, I'm here with Matt Sage. Matt, thank you so much for being on our show today. How are you doing?
I'm doing great, thank you.
So that's great. Thank you so much. And let's get started with you. Tell us about your introduction to pharmacies.
So from a pharmacy perspective, I've been a pharmacist for 20 years. Started out in a big chain environment, was a regional manager there, and then moved over to Advanced RX Pharmacy about 10 years ago, which is crazy. Can't believe it's been that long. Wanted to get back to more of a kind of community feel as opposed to a big chain pharmacy environment. So that's kind of my history. The pharmacy's history, we've been, like I said, I've been here since the beginning. We started 9.5 years ago now. We have 3 locations now. We started with just one in Round Rock. Now we have one in Round Rock, one at off of Lamar in Central Austin, and one up in Amarillo. 3 different pharmacies. They're all open door retail situations. They are located next door to Advanced Pain Care, but we don't just see Advanced Pain Care patients. We also see patients that are not affiliated with Advanced Pain Care at all. We offer compounding services at 2 of our locations, the one in Round Rock and the one up in Amarillo. And we've got a ton of different convenience options for patients. We do delivery. We've got curbside pickups. We also do have an app so that patients can communicate directly with the pharmacy teams and with pharmacists. A lot of good stuff going on in our pharmacies.
You mentioned the growth, which is great to hear, and how your pharmacy welcomes anyone, even non-advanced pain care patients. How do you maintain that sense of personalized care as you grow?
When I was graduating from pharmacy school a long time ago, pharmacists were known as the number one most trusted medical professional. So, and since that time, that's changed a little bit. And I think a lot of that's due to access to your pharmacist. So in the past, it used to be you got sick, you went into the local pharmacy, you went and talked to your pharmacist, found out what was going on. As pharmacies have grown and gotten busier and busier and busier doing so many things, a lot of pharmacies aren't staffed in such a way that they can really focus on the patients and talking to the patients and kind of helping them out. That's one thing we've done a really good job at. We have amazing pharmacy teams, first of all. I've got great pharmacists that work at all 3 locations, great technician teams, but we staff them in such a way that our pharmacists are able to interact with patients every day. Every patient who comes into the pharmacy usually walks in and talks to me at some point, know a lot of them by name. And that's kind of that mom and pop feel that goes back to, 20 years ago when I became a pharmacist. But yeah, that's really what we focus on to continue that personalized care. We've got amazing teams. We staff our pharmacies right so that we're able to interact with patients and give them the care that they've come accustomed to from us.
Now, you describe working closely with advanced pain care providers, attending meetings, handling prior authorizations, calling doctors directly. Can you share a real-world example where that collaboration made a significant difference?
That collaboration is something we do every day. So there's a lot of examples of this. I can give you just one from last week. We had a patient who had a brand name medication that was prescribed by their provider. It required a prior authorization. Prior authorizations are just your insurance company wants additional information before they'll pay for it. It's usually on expensive medications. They always want some additional documentation because they don't want to pay. So what they required was a prior authorization. What I was able to do was reach out real quickly to their doctor's office. We're able to get this done in-house because instead of having to go faxing and do all these things to get through to the prior authorization department, which does an amazing job, I'm able to just reach right out to them. They got the medication approved. Problem is that it got approved on the insurance and then their copay was $250. And this patient was on a limited income. They didn't have the opportunity to pay $250 for it. So then I turned around and reached out to the doctor, gave him a couple of options. What ended up happening was we switched them to a compounded medication that got them the exact same medication, similar dose, for $30 instead of $250, which saved the patient a ton of money, got them the same medication. It worked out great for the patient. And that kind of stuff happens every day. And it's really one of the big benefits of working with and alongside Advanced Pain Care. We're able to help patients when that comes around because things like prior authorizations, those happen all the time now. It's really kind of more, it used to be the exception. Now it's a bit more the rule with insurance companies.
So let's talk now about convenience and accessibility. With services like curbside pickup, next day delivery, and app-based chat, what have you found to be the most impactful convenience feature for patients?
From a convenience perspective, the biggest thing is definitely the delivery option for us. Patients are accustomed now to having everything brought to their door, so they are always expecting, prescriptions to be sent to their house or whatever that might be. And I think that's especially key with the patient demographics we see. We see a lot of patients who have mobility issues or can't drive up to a pharmacy or whatever that might be. And the convenience of being able to have a prescription delivered to your door is really something that they all are using, it seems like, and really appreciate the ability for us to get the prescriptions right to them, make it as convenient as possible.
Those are all great services to have. So some of your pharmacies offer compounding services. What is prescription compounding?
So compounding is it's the technical term is it's a custom formulation of a medication to meet a unique patient need that can't be met commercially. So that's the fancy way of saying we're able to make a specific medication that meets your specific needs. One of my patients called it bespoke medicines, which I thought was kind of a fun way to say it. I'm trying to make it a thing. I don't think it will be, but it is a unique thing to our pharmacy, and it's something that we really enjoy doing, and it's been able to bring a lot of positive outcomes for our patients.
Now, how does prescription compounding improve outcomes for patients?
We are able to tailor a therapy specific to that patient. So that can be as simple as you have a medicine that's for your kid and it tastes terrible. We're able to flavor that medication so that it's a little bit more palatable for your child. That's a really easy way to do that and probably the easiest option with from a compounding perspective. We take that all the way to making on a more complex scale. We take medications and make specific formulas for patients. One example of that is there's a commercially available medication called naltrexone out there. The dosage you get medications from a retail pharmacy, that one would be 50 milligrams of that medication. Our doctors prescribe it in like 1 and 2 milligram increments. Well, there's no reason to do a 50 milligram tablet when you only need 1 or 2. So we are able to compound that. That decreases side effects. It makes it a little more affordable for patients. Really a great option for those patients and able to treat different disease states than you would with the commercially available version of that.
Now, you gave some really good examples, but what's the most surprising compounding request you fulfilled?
We do sometimes do compounding for pet medications. We've had a number of dogs and cats that we took care of. The most unique one was a liquid medication. It was for a dog, and they wanted it compounded so that it was a bacon flavored medication so that the dog would actually eat that, or I guess drink it or lick it up or whatever. And we were able to do that. It actually smelled delicious, but I didn't try it out. I'm sure it was good though.
That was going to be my follow-up question if you tried it out, but you already answered that one. Moving over to CBD counseling. CBD is a common interest in pain management. What are the most frequent questions you receive, and how do you determine if CBD is suitable for a patient?
So CBD, it is a hot button. A lot of patients want to talk about CBD, and most of them come from a place where they really don't know where it fits into their treatment plan. So I think the biggest thing with CBD and all those CBD products, they can be good add-ons. I think it's about managing expectations for patients. I have patients who come in, they're like, hey, I've been on this pain medication for 15 years. I'd like to start taking these CBD gummies and get off all my pain meds. Well, while that may be possible, more often than not, it's something that you add on and maybe you decrease those other things. So it's a great option and it does help a lot of patients. My wife takes it. She thinks it's amazing. It helps her sleep at night. My mom takes it for arthritis in her hand. She uses a topical version of it. So it is very beneficial for a lot of patients. It's just about managing expectations, because if you go into it thinking you're going to get off all your other medications, the minute you start taking a CBD supplement, you're probably going to be set up for failure. But if you are kind of planning on it being an add-on that helps you decrease some of the other medications you're on, then those patients seem to do pretty well with it.
We mentioned earlier about the app, and I want to circle back on that. So your app helps patients manage multiple prescriptions, refill requests, and even chat securely with a pharmacist. How has this tech improved engagement and outcomes?
I think this one, it kind of goes back to the conversation about accessibility to the pharmacist. So that one is the one. So obviously managing your prescriptions in the app is important, but accessibility to a pharmacy team member is so important. So you don't have to pick up the phone and wait on hold for 20 minutes to be able to talk to a pharmacist or a pharmacy technician and find out what's going on with your medication. You just shoot a text over to us. You get a pretty quick response, and you're texting with a pharmacist a lot of times. Some patients use it and send us pictures of things. Sometimes that's not amazing. We see some pictures I don't necessarily want to see, but I've had patients send over pictures of wounds that you didn't want to see, and you're just like, wait a minute, you don't need to be spending time on this app. You need to go see the doctor. and get that stitched up. But yeah, I think the accessibility has really helped with the patient outcomes because you can save them an emergency room trip in some cases. In some cases, you can tell them they need to put the phone down and head on over to the ER and get themselves taken care of.
That's a good note to have for sure. So for injured workers, you assist with approvals, billing, delivery. How does that streamline recovery? And can you highlight a case where your involvement made a real difference?
So workman's comp, it's a complicated arena from a pharmacy perspective. There's a ton of red tape. Everything needs approvals. It is a difficult thing for a pharmacy to handle. And then you take that to the patient level. That's even worse for a patient because they are just waiting on their meds to be filled. A lot of times they're in pain. So what we're able to do is work with the doctors and have conversations with them about what medications are going to put roadblocks in the way for the patients where they're not going to be able to get the medications that they need. Having those conversations, then also being able to get approvals for them with their adjusters, with the workman's compensation companies. What we've been able to do is we get the medications to the patients faster so they're not having to wait. I have had many patients who were on workman's comp. They'd get a prescription sent in. They'd wait a week for an approval on it. The approval doesn't come. It takes forever. We're able to bypass that part of it. We do some different billing stuff. We work directly with the doctors, and the patients get their medications in a timely manner so they don't have to suffer. There's no reason to suffer with pain when you don't have to.
My last question is about emergency and logistical challenges, and I'm really excited to hear your answer. When unexpected medication delays or insurance hurdles arise, how does your team typically step in to resolve them quickly?
I think with those things, this is where our unique situation with advanced pain care really comes into play. So medication delays and shortages are, in the past 2 years, there have been more medication shortages than I've seen in the 20 years prior to that as a pharmacist. It just seems to be happening all the time now. So the way that we work with that is we let the providers know ahead of time. Also, it looks like, hey, this medication is going to be out of stock probably next week. You guys might want to look at a pivot for those patients. And in the case where they're prescribing something that's unavailable, we're able to reach out, make recommendations, kind of draw on some of that clinical knowledge that our pharmacists have to make a recommendation, have a collaborative discussion with the providers to make sure that the patients are getting something equivalent to what they had since what they had been on is unavailable. The other part of that is the insurance piece. Insurances have gotten more and more complicated over the course of time. At almost everything that you get, if it's expensive, it's going to require a prior authorization, which is going to require additional paperwork. We're able to, again, leverage that relationship we have to get those taken care of quickly and efficiently so that the patients aren't having to wait. Or if it ends up being something expensive, like we talked about before, making a pivot with their therapy so that we can get something that is inexpensive for the patient and it continues their treatment.
Matt Sage, Director of Pharmacy at Advanced RX, in support of Advanced Pain Care. Thank you so much for your time today.
Thanks for having me.